Hi, Dr. McCarthy here with Migraine Treatment Success Secret number 4. Today we're going to talk about how do you know if you are autoimmune. We spoke about how an immune system issue could be what's perpetuating your migraine headaches, and it's never even properly been evaluated. You don't know, you're just guessing. And to tell you the truth, I'm just guessing that you have an autoimmune problem right now. I don't know. How are some ways that I can solidify the fact that you are autoimmune? Well, first of all, if you already have a diagnosed autoimmune condition, some other autoimmune condition, Hashimoto's or lupus or scleroderma or rheumatoid arthritis or one of these type situations, if you have a documented autoimmune condition, we already know that your immune system is definitely playing a role in your chronic health problems. We need to determine whether it's playing a role in your migraine problems. We can figure that out. Secondly, it's very common to see that symptoms wax and wane. Well, people will get a whole bunch of migraine headaches over the course of a few days or a few weeks, and then they can go a few days and weeks with no symptoms. And this is a very common pattern to see in people who are suffering with autoimmune conditions. Typically, they call these flare-ups. Well, we need to figure that out, but if this is a pattern that you exhibit, very good chance that it's an immune system issue. Another way I could tell is when we have new patients come into the office, I tell them, bring in all the supplements. Let me see all the supplements you're taking. Well, if you have to carry a bag with 2 hands, if you walk in with a bucket full of supplements, not a good sign. Typically, those are the patients who have immune system problems. They're taking everything under the sun. Now, some of those supplements might be helping, but invariably, some of those supplements are stimulating the wrong side of your immune system, and they're actually perpetuating your problem. So you've got to let me evaluate that for you. Next, we request all of your past medical records. If I see that you've got hundreds of pages of medical records, not a good sign. That's typically someone who's dealing with an autoimmune problem. Been everywhere, tried everything, and you still can't get results. Lab tests are normal, but you still have your symptoms. That's because you're not in the right place yet. Our office is the right place for you. Typically, we'll see with people who have autoimmune problems is that their life fell apart after some kind of sickness, after something happened that stimulated their immune system, and life just fell apart at that point. Or very common to see in pregnancy. In the 3rd trimester of pregnancy, most females are Th2 dominant, and then postpartum, they become Th1 dominant. That sudden shift in their immune system towards Th1 dominance, this is what can flare up an immune system, and it can start these autoimmune issues, specifically autoimmune thyroid problems, which can then impact your migraines. It can actually create migraines. We've seen this a lot. I didn't have migraines. I never had problems until after I got sick or until after I had my baby. Lastly, again, I'm just going to keep driving this point home. You're never going to know what's wrong with you unless you get the proper tests done. If you haven't had the proper tests done, you're just guessing. You don't want to guess with your health. Don't suffer another minute with unnecessary migraine headaches. Give my office a call now. Thanks.